Good afternoon to you. You're with Newsfeed. Well, more, of course, on the President and Pala and that parliamentary panel finding the moment that there are any developments. Our teams are working on it. Meanwhile, Botswana has become the first high-burden country to be certified for having achieved a vital milestone on the path to eliminating the mother-to-child transmission of HIV. High-burden HIV countries are those defined where more than 2% of pregnant women are living with the virus. That's according to the World Health Organization. It says Botswana has now achieved that status, meaning it's got now closer to eliminating mother-to-child transmission of HIV. Our reporter Refiloe Seboko joins us now with the latest. Refiloe, good afternoon to you. How did Botswana do it?
Good afternoon, Stephen. We are just about to find out now from Jomo Ditebe, who is the mayor of Lobatse in Botswana, to tell us how Botswana managed to eliminate the mother-to-child HIV transmission. Ntate Ditebe, thank you so much for your time and welcome to Newzroom Afrika. An achievement for Botswana in being able to eliminate the mother-to-child HIV transmissions. How did the government of Botswana manage to do that?
Well, thank you for having me on your show. Let me just start by recognizing that our government have started to work on this program for PMCT, which is prevention of mother-to-child transmission, for a couple of years now. And the nation and the mothers of the country have all been tested at a certain stage before they can give birth. And those who have tested positive, the government will run them into that program so that they can prevent the infection of the child before birth.
Mm-hmm. And I think when the World Health Organization made that declaration last year, it might have been something that you say as the government of Botswana that becomes an achievement. But how do you make sure that even going forward you keep on that being the status quo altogether?
Well, the most important thing is education. What we did as government, we have educated our people and the importance of this disease and the dangers that goes with it. The other thing that we do as a country, we have integrated our community to be part of the program. The volunteers who help the government to spread the information. And the most important thing that happened along those, it was the mindset change. The people of Botswana, they realize the importance and the dangers that this disease carries, and it has hit us in the 80s, early 90s severely. So the people of Botswana, those who were not affected, those who were not infected, they were affected in any way or other. And that is why the whole mindset of the nation changed towards the disease. We focus on ending it.
And maybe give one a picture in terms of health services in Botswana, in making sure that those infected by HIV are able to get help and access health services in Botswana.
Well, the country has a brilliant and the most functional health system that can mitigate this kind of problems. In a couple of years, the government has built a lot of clinics. I would say every village in Botswana has a clinic, every neighborhood has a clinic, and there are hospitals that are referral to when people come from the clinic, and health educators in every clinic that helps the government to spread the message and combat all diseases, including HIV/AIDS.
What remains of concern to the government of Botswana? We were just having a chat just before we went on air that you have also found out that kids in secondary schools or in primary even are getting infected by this virus. What remains of concern, and what is it that you are finding in terms of infections to kids as young as those who are still in secondary and primary school?
The people that usually are affected are teenagers, not at primary school, at people after finishing their secondary education. When the young kids the teenagers start to be sexually active, you find that these are they'll be exposed to this disease because of the time for starting to explore and getting into this thing.
Stephen, that is Jomo Ditebe. He is the mayor of Lobatse in Botswana. He was one of those that was giving the keynote address, or rather the presentation, in terms of the integration together between the Botswana government together with the South African government. The Northwest government in this particular, as the Northwest province was commemorating the World AIDS Day, and he was making that presentation during that the World Health Day commemoration, which is happening in Mahikeng. And he's saying that some of their concerns, as much as they've been able to achieve the issue of mother-to-child transmission, eliminating it altogether as it was declared by the World Health Organization, there's still some concerns of those who are still in secondary school that are being infected by the HIV, and it's because they're trying to explore and just getting into their teenage years, and that remains of concern. But however, they'll keep an eye on that as the Botswana government.
Refiloe Seboko, live. Thank you very much indeed. Do appreciate that. Live, of course, from Mahikeng.